Well, good morning again, everyone, and I want to thank you for joining us for this session. This is with Dr. Sam Wafi, who is a clinical psychologist and founder of the executive director of the Rare Disease Ghana Initiative. It's a national non-governmental agency organization. It represents congenital, undiagnosed, and genetic and rare diseases in Ghana. So with that, I'm going to turn the floor over to, I call him Dr. Sam. And welcome, and we're excited to have you and look forward to your presentation here.
Yeah, thank you. Thank you, Jeff, for the opportunity. And I want to thank everyone for making the time to listen to my presentation. I hope I'm able to meet your expectations. Yeah, so I'll be talking about rare diseases and looking at the linkage with mental health. And in the course of my presentation, I'll zoom in to talk specifically about indigenous populations and developing nations and what we need to do for that group. I want to start with telling you about how my journey came into rare diseases. And from my background, I am a clinical psychologist and came into rare disease advocacy in the early years of 2017 when I was doing my clinical rotation in one of the teaching hospitals in Ghana. And while I was doing my rotation, there was a family who was referred to me for me to help with provide some mental health support to the family. And the family lived with an undiagnosed syndrome and had a child who was about few months old, less than a year old, who had gross developmental delays. And it was striking looking at the amount of stress that the family was going through, looking at the frequent other mental health issues that were coming up. I was keen and interested to know why. And from the history, realized they had other children who equally were affected, had some neurological condition. In fact, all their 4 children were affected. So I was really impacted by the story of this family and began to ask questions regarding what the next steps are for this family and what systems were in place for families who live with these conditions, unknown syndromes and other families, and what existed for them. And I realized that there was virtually nothing in place, and families have to deal with them alone, and they had to go through the journey alone, which I found to be very difficult and tedious for most of the families. And so this brought me into advocacy for rare diseases, trying to find help for this family. And so living with rare diseases and genetic diseases whether diagnosed or undiagnosed, has been associated with a huge emotional impact and mental health impact. And that was, you can see, that was the angle I came from. And so I can strongly relate with this impact. Typically for rare diseases, it is there's a general lack of awareness for rare diseases, which means that most times there isn't much information to give on the condition. At the same time, most clinicians are most likely to misdiagnose and potentially mistreat because they do not have the prerequisite or the needed knowledge and information to adequately manage the condition. And in all of these, the impact goes to the family. They have to deal with the stress, they have to deal with the uncertainties, they have to deal with the frustrations, they have to be looking around for information and be doing all of the research alone. And it can be very, very devastating situation for most of the families. In addition to the lack of information and an awareness on the condition, there is also the challenge with access, general access issues. One of them being having access to specialists who may have some information or have some knowledge to manage the condition, having access to healthcare, the specialized healthcare services that families need, having access to diagnostics, having access to treatment and uncertainties about treatment. These are all general issues regarding access, and even social services. Most patients cannot have access to social services. I remember this family, one of the most frustrating aspects of their care or of their stress was the fact that schools were not willing to admit their children into their schools, and this became very, very difficult for the family because they have to keep all the 4 children in the house, and because of that, the parents cannot work, and it bringing in other issues of poverty and disempowerment on the families. And so it is indeed very important for the issue of access to be addressed, because then it's worsening the mental health impact that it has on the family. All of these were brought to light after through some publications which were done first in 2013 by Share Report, where there were issues of depression and anxieties, high levels of depression and anxieties and stress, as well as other psychological issues raised among the rare disease community, which was when they compared the US and the UK sample, they realized that patients did go through a lot of frustration and anxieties in being able to access care. And recently in 2018, the Rare Disease UK also published their report where they found that 95% of patients and their caregivers experienced worries and anxieties, and about 93 also felt depressed and stressed, and a great number also felt low, and even they also reported that a section of the population also were having suicidal ideas. And these were all issues that I realized in that small family that I had, who experienced series from anxiety to stress to depression to suicidal ideas, with homicide ideas due to stigma in the community, where they felt they just could potentially end the lives of the children and be free of this stress, and all of these come in being able to impact, telling the full story about rare diseases, and when we do not have diagnosis and we do not have treatment for the families, it is very common. It now tends to become more of a mental health needs that needs to be addressed, because then we have to think about how these families will adjust to the community or adjust to their routine life, and how best they can live a functional life moving forward. And so it's very, very important that we look at the mental health component as well. Yes, so this bring to light about these are general issues that happen to rare disease communities globally, but for indigenous communities, when we talk about indigenous communities, we are talking about people who live within or are attached to a certain geographical distinction or traditional habitat, or a certain territory where they identify themselves as being part of that distinct cultural group, and they descend from groups that are present in where they live. They find some form of attachment to the place, and they have these cultural and social identities, and as well as to their institutions and the area where they occupy. And this is the case of most people in developing countries. This is the case of most people, especially in Africa, where we have this strong attachment to and beliefs and cultures that equally come to some extent serves as a buffer to help us deal with our daily mental health struggles, but in other ways also comes to impact our mental health when we find ourselves in certain situations. So for rare diseases, like most constructs, like most other issues which are dealt with within our cultures, I'll use Ghana as an example. Most diseases and most illnesses which are not familiar with us are treated more of what we call the familiar unfamiliar, where we treat them like they don't exist. We like death. We behave like death do not exist, or it's something we don't have to talk about. It's a taboo. And so all of these things, these familiar unfamiliar concept, is also brought to the rare disease community. I remember meeting somebody who was pregnant and had to talk to the person, and was talking about rare diseases, and a person was like, I don't want to see the pictures. And I said, why? Because I'm pregnant, I may give birth to these children. And as you can understand, these usually are sociocultural issues that exist. And so when somebody gives birth to a person with a genetic or rare disease, and in a situation where the diagnosis may be delayed, and the family may give birth to maybe the second or the third child before an awareness is brought to that family, like the family that made me start the Rare Disease Initiative that I've been supporting. It is the case. And so by the time somebody gets access, the person has already had other children based on the cultural belief where people think it's a taboo, and sometimes people think it's some spiritual forces punishing the family, and all of these also play a huge role in being able to tell how the people will relate to the healthcare or the health system or not, or even how they will participate in their healthcare. And these cultural issues, the belief systems, the perceptions, the way that people perceive these conditions add extra stress to the family. It adds extra burden to the family because, for example, in Africa, in Ghana, where I live, family has a strong identity, adds to our identity. And so if there is a genetic condition in the family, society also behaves in a certain way towards that family because it's believed, because there's not much awareness on these conditions. There's a lot of representation on which the spiritual is part of the way people perceive these conditions. And so people begin to make some interpretations, which usually are negative interpretations towards persons living with this condition. And it makes it now adds to the labeling of the family, the whole family, and which makes it extra difficult for somebody who has such a condition to even open up and be able to receive services and support. And so it's very, very important for us to be concerned about these issues when we are dealing with indigenous population, and especially those in developing countries, because these are part of them. It's part of their identity. And so if there's a genetic disease also some way, somehow becomes part of them. And we have to put in a lot of effort to demystify the beliefs about genetic diseases within these cultures. We need to put in a lot of effort to change the perceptions and how people view genetic diseases. So there's a need to invest a lot in education and awareness, community engagement initiatives, so that we'll be able to reduce that burden, to reduce the burden, as it has a great impact on mental health for these communities. In addition to the existing sociocultural issues, people who live in developing nations and indigenous communities already have existing inequalities in access to healthcare. The healthcare already, the systems have not been fair to these communities. They do not have the needed infrastructure. They do not have the needed human resource. They do not have the needed capital to access healthcare in these communities. And so if someone has a rare disease, we all can relate to the huge financial cost that it comes with in being able to access genetic test services, in being able to access treatment when available, even being able to access healthcare, as the healthcare is usually scattered and fragmented across the country. So if I take Ghana, for example, someone would have to travel all the way from the northern region to be able to access maybe a rheumatologist. If we have to travel from the northern region to the south, travel like hours and possibly days to be able to access a rheumatologist, which increase the cost that they have to bear. And so the existing systems, inequalities in healthcare delivery is a huge problem that also impacts the healthcare, the mental health of the people. Because then you are afraid to just have a rare disease. You are afraid to have any condition which is not common, that you cannot have access to specialists. The other challenge is the introduction of new technologies. And these technologies and how it will relate to the existing socio-cultural system that exists among these communities. And I've been thinking about this very well and say, okay, how do we deliver, how do we advance precision medicine to these communities? How are we able to get the people to understand how genetic testing will benefit them, looking at the fact that they are very close, tight family systems in there, and concerns about family identity and family stigma and other things that may go on if somebody is found to have a genetic disease. These are all other issues that has come in, and we need to explore all of these avenues and be able to reduce the impact that it may have on the family. And also another thing has to do with the language. The language, most of the people predominantly speak their indigenous languages. And so with these new technologies, how do we bring healthcare to them and make sure that they understand the healthcare that is being delivered to them? Because the lack of information in itself is impacting on their mental health. And so we need to also look into all of these issues. And as we can all understand, there are other socioeconomic issues that already exist in these communities. One of them being the fact that a lot of people remain unemployed, and there is a lot of poverty within these communities, as well as political instabilities and wars and other sociocultural issues, including stigma, very high in these communities. All of these have to be looked at, and we need to be able to understand how mental health care delivery, how we can resolve the mental health care of these people, but we can provide mental health care and reduce the mental health impact that rare disease can bring to people within these communities. And so it is very, very necessary that we look at it. So what can be the way forward when we want to deal with mental health for these communities? My recommendation would be that we need to invest a lot in ensuring that we achieve universal health coverage for all. And we have to ensure that everybody can have access to healthcare. And we also have to prioritize mental health care for rare diseases and their families. This we can achieve by making the effort to make a direct investment in mental health and supportive services within the communities where they live. So it will require a lot of investment in training more mental health personnel, and also, if not more personnel, making sure that mental health training is part of medical training for medical personnel who will be sent to communities to deliver care for patients, as they will get a chance to meet a patient with a rare disease within these communities. It's very, very essential that we look at it. So we need to prioritize mental health care for rare diseases. In addition, we need to also ensure and enhance local collaboration. And so we need to empower local initiatives and encourage the participation of the people. In that way, we'll be able to tease out all the other cultural issues and how best we can work with them. These will help in efforts to preserve the culture and the beliefs of the people, because in as much as we want to deliver healthcare to them, and be able to bring in new technologies with regards to rare diseases. We also have to be very conscious in ensuring that we are preserving the identity of the people, we are preserving the culture of the people, we are preserving their belief systems, and we are not in any way destroying them in the process. And so it is very, very essential that we look out for all of these issues as we advance in rare disease care. And so I will, my final words will be that we need to understand that rare diseases and mental health goes hand in hand. And as much as we may perceive rare diseases as purely medical conditions, we also have to understand that where there are no treatments available, and where diagnoses are delayed, and where policies are not yet in place, for most part of it, it becomes a mental health issue that needs to be looked at and addressed. It becomes issue of an adjustment. It becomes an issue of a daily life. And we understand that rare diseases are chronic diseases, and like most chronic diseases, it comes with a lot of mental health needs. Apart from these needs, there are specific rare diseases which are associated with mental and behavioral challenges that needs to be addressed. And so we need to ensure that we put in the needed efforts. We make sure that every patient who lives with a rare disease, every patient who is being diagnosed or suspected to have a rare disease is also being provided some form of mental health care, so that we together, the family, together we can achieve the sustainable development goals. Together we can all achieve a sustainable health care and be able to ensure that patients adequately participate in their health care as well. And so these are my final words, and I will like to thank all of you for your attention and for your time. I look forward to future engagements on how we can all work together to achieve a common goal for the rare disease community. Thank you.
Thank you, Sam. We really appreciate your time with it. We do have a question that came in from Tintin. And he is addressing with, let me see here. Hold on one second. He says, rare disease advocacy in Africa, especially for indigenous persons, when African states are caught up with COVID-19 and failing to contain it, how best as rare disease advocates can we stay afloat and be there for the rural population?
Yeah, thank you for the question. In fact, the issue of COVID-19 has been a huge challenge for the globe, and within Africa, we need to continue to engage with our authorities and be able to adopt or adapt our mode of work. One of the strategies that has been proven to be helpful is the fact that we need to talk with our care providers, especially the clinicians who deliver the healthcare, you need to work with them, find out what would work best for them in terms of continuity of care for rare disease communities. We know very well that not every rare disease patient in Africa can have access to some technology. Teleconferencing, though useful, may not be the solution. And so as much as possible, what we have been doing is to be as a patient advocacy organization, is to be actively part of the care. And so we do the coordination, talk to the clinician on behalf of the patient, book that appointment, and find when it's safe for the patient to get to the hospital, and then make sure that the patient is also going in there. The supply of protective equipment has also been very, very useful. And I've seen that in Zimbabwe, for example, we've done a lot with supplying PPEs to patients, to communities. It's essential, and it's also very, very important that we continue to do that, make sure that every patient has PPEs. We also have to have a role to ensure that every patient have access to the information, the needed information. And so as patient advocates, there's also a need to prepare toolkits and vignettes and other things that you can share with the patient community, so that they learn and they are empowered. And for us, what we did is to ensure that we tell the patients that if not anything, they have to ensure that they are protecting themselves because they are vulnerable groups. This was very, very important because when we did that, most of our patients also took the necessary precautions, and we only had one patient who was affected and has been treated. And so patient advocates need to be fully involved in the process, have to engage the necessary authorities that have the power to make any change, including the patients themselves, and also continue your advocacy work, find alternative means. The social media is there, write emails, write letters, post it to your whoever needs to know, and through that, I'm sure we'll achieve a goal.
All right, thank you so much. And thank you for your time today. You know, if people were wanting to send, I know that like we worked with a couple of organizations here, you know, that my city Med to send over some ventilator splitters that, you know, with it. But if people wanted to send stuff, is there some place in particular they should send, you know, material or just things that they could help with? Is there, you know, supplies, general supplies and stuff like that?
Yes, definitely. In Ghana, we can receive items of any kind to support our work by sending it either through DHL, FedEx, or to Rare Disease Ghana Initiative. And our address is F393 4th Oche Street. Oche is OTSWE, Oche Street, Accra. And my phone number is 005 +233 050 0017 and so you can mail us directly using any of these using our address, and we will receive it will receive it. You can send us an email at info@rarediseaseghana.org, and also you can send us a message directly through Facebook, on WhatsApp, and through any of our social media portals. You can contact us, but we are very open to receive in-kind donations as well as donations of cash, is any form, anything that you can do to help the rare disease community grow across Africa and Ghana, and we'll be happy to receive and share among our communities.
All right, excellent. All right, well, Sam, thank you again. It's been a great seeing you. Thank you for your time. For those that are listening, the phone number, address, and stuff we will post as well, not just with the recording if we didn't have a chance to get that down. And we appreciate everyone and your time here. Sam, thank you again. It's been really great. We really appreciate it. Oh, hold on one second. Yeah, thank you. 1010 says thank you. Thank you from us as well. All right, everyone. Thank you so much.
All right. Thank you all.